known veterinary group in Bristol has a reputation for being able to treat exotic pets. Ian Calvert, one of the vets here, developed his interest in exotic animals when he was a child.
When we come to do surgery on animals like these reptiles, we have quite a few problems that we don't have with cats and dogs. Now, you're probably thinking to yourself, how on earth does he manage to do surgery on an animal like this with conventional equipment? The answer is you can't. If I can just give you the snake.
Yeah, sure. Got the snake. Good.
We'll have a special kit here for doing that.
Yeah.
I'm just going to fry my breakfast for you. This is a little electrosurgical knife which you can see can be used to make tiny little cuts in tissue. So even a tiny animal like that is possible for me to operate on. Lifestyles are changing. One of the nice things about reptiles is that they do tend to fit in with our lifestyle of gadding about all over the place. If you've got an animal that you only have to feed once every 2 weeks, it's much easier to take care of and you don't need to take it walks than if you've got something like a dog which you have to look after every day.
He was tiny when I got him. He was the baby. He was the runt of the litter, so he had to be looked after quite a lot.
Why is he squinting?
He's only actually got one eye. His left eye is somewhat deformed, and he was kind of picked on by the rest of the bunch. So had to hand feed him rather a lot, and he's all right.
Are these quite difficult to look after?
Yeah. You have to think about it before you get them.
An animal like this eats a fair amount of a rather specialist diet. They eat crickets and locusts, which are quite expensive if you have to feed a big animal like this. What I'm doing here is I'm just dialing into a thing called the Veterinary Information Network, which is situated in California. What this allows me to do is to talk to vets that are dealing with exotic animals anywhere in the world. For example, if I wanted to find out how to vasectomise a Burmese python, I might put a message on here. There we are. There's somebody who's done vasectomies on Burmese pythons, and he's going to tell me exactly how to do it and what the pitfalls are, etc. And I can leave messages of my own on here. I had a case with a vitamin D overdose today. I'm not quite sure how to deal with it, so there's a question. I'm saying, reptile vets of the world, anybody got any answers to this question? Isn't that fantastic?
Ian had to go to America to get his training in exotics, and as there are so few training aids available in this country, he makes his own, such as this film.
5 years ago, most female iguanas died once they got to about 2 to 3 years old, until it was realised that the females were getting egg-bound and dying as a result of egg peritonitis. And then people in the States said, why not spay these animals, just like we do cats and dogs, remove the ovaries and uterus, and then we got rid of the problem. And that's exactly how we deal with this particular problem. We now have female iguanas that are into 10, 12 years of age. Vet schools tend not to do very much in the way of teaching on reptiles. So one of the things that I can use the tape for is to show to vet students how you do particular operations.
Back in Bower Ashton, Bruce the police dog is being put through his paces. The dogs here are the best in the country. The Avon and Somerset dog section team were the overall winners of the National Police Dog Trials held earlier this month in Scotland. That was fantastic,
Thank you.
though.
Thank you.
Excellent stuff.
Bruce, sit.
And how does the agility training that you do with Bruce relate to the work that you do within the forms?
Very much so. As you would expect, operationally, dogs have to encounter all forms of obstacles. What we've tried to do here in a training environment is replicate those obstacles. The 3-foot hurdle could be a front garden gate. The long jump could be a ditch or a cattle grid. And obviously the wall could be a fence or a wall that you're going to come up against operationally. We work on a one-to-one basis, one handler to that one dog, and you work totally together. In actual fact, you spend more time with the dog than you do with your family, really.
I understand you've got a bit of stick about your training methods, is that right?
Yeah, that's true. I think some people have a perception that our training methods are harsh. As you can see with Bruce, he's a bouncy, happy sort of dog. He's been with the police service since he was 8 weeks of age, so he's been brought up to this type of work. But above all, it's done on fun. And if he wasn't, he wouldn't do it.
Excellent, thanks Dave. Well, our next item is with Peter Neville, our pet therapist, who's having problems retraining a troublesome collie.